You cannot be denied HRT if you're overweight, you have a high BMI, or you're living with obesity. Whatever you've been told, it's wrong and it needs to stop. You need to have a tailor-made plan, individualized to you, not what the blinking scales say. I will keep repeating this with data and receipts, because we now have evidence-based data to say it is safe for women to have systemic and localized HRT to manage their menopausal symptoms. And yes, an individual risk-benefit assessment is crucial, especially considering the increased risk of venous thromboembolism, cardiovascular disease, breast and endometrial cancer, particularly with those living with obesity. Now, while HRT itself is not a weight loss medication or a treatment, the studies suggest that it may actually help control weight in those that are gaining weight because of the menopause, because your hormones, your estrogen, progesterone, and your testosterone is all in flux. Therefore, it makes it harder for you to lose weight. And we've got plenty of data from the British Menopause Society to say that women in the perimenopausal phase of their life actually put on to about 1 stone to 2 stone in weight, regardless of what they're eating. So it's not simple as calories in and calories out, move more and then you'll lose weight, because you are biologically programmed to make your sex hormones in order to replace what your body needs through your adipose tissue. So you put on weight in that menopausal transition, and that varies based on genetics, your environment, stress, cortisol levels, what you're eating as well. Alcohol consumption will also contribute to weight gain as well, and also the processing of alcohol changes as we transition through postmenopause and menopausal phases. So it's so important to think about transdermal, body identical, micronized progesterone in women, also the 52 milligram levonorgestrel coil in those that are overweight or living with obesity. It is safe for them to have the coil to provide as their endometrial protection, as also be part of their HRT regime for them as well. Localized topical vaginal estrogen is absolutely safe, works locally, doesn't increase to the risk of clots, does not increase risk to breast cancer, and also doesn't increase risk of endometrial cancer, so can be used alone or alongside systemic HRT. But this whole notion of saying to women, well, lose weight and then we'll put you or consider an HRT, is something that for some reason, I'm seeing this a lot in my clinics at the moment, and it's something that's going around on social media. It needs to stop because it's not correct. And please always go empowered. Please do not deny women any treatment of any form until they lose weight, because we are hormonal beings and our hormones make it difficult, especially if there's underlying PCOS or endometriosis or adenomyosis or fibroids, you name it. I hope that's been helpful. Happy to take any questions.